keep you alive. The surgeon does his work. During his operation, there is a lot of bleeding that goes on. It's we to make sure that we replace that blood and make sure that you are very safe.
A senior lecturer in anesthesia at Kabale University, Dr. Henry Mugerwa, has commended regional anesthesia initiatives for lowering complication rates and promoting faster recovery. However, he highlighted significant challenges in Uganda, including the shortage of trained professionals, inadequate equipment, and the high cost of education.
So anesthesia is a branch of medicine that is very critical because many people know when they are going to theater, they only know and think about the surgeon. But the fact is, the surgeon cannot operate you if the anesthetist is not available to give you drugs that will make you, number one, not feel pain, but equally important to make sure that you are very safe.
He appealed to policymakers to offer scholarships for talented students from disadvantaged backgrounds and increase funding for training and essential resources. The head of the anesthesia department at Kabale University, Dr. Isabella Epo, emphasized that regional anesthesia is a less invasive that enhances patient safety and satisfaction.
So this technique really needs to be well taught. People need to be sure of the practice before they actually start this procedure on a patient. Patients need to have the information so they can choose rightfully between having a general anesthetic or a regional anesthesia. But overall, there are more benefits for having a regional anesthesia, including a reduced length of stay in the hospital.
She too called for government to support and address equipment shortages and the need for more trained professionals. Local healthcare workers such as Jane Kamariza and Grace Businje from Kabale Hospital expressed concerns about the risks of traditional anesthesia methods, including patients sometimes being in a coma for up to 12 hours. In contrast, regional anesthesia is seen as a safe and less intimidating.
In the absence of the right equipment, of the right needles, of the right drugs, you end up having a patient who would have benefited from a regional anesthesia eventually ending up having a general anesthesia. And yet, if these products were available as required, as per the volume of surgery, you would find that patients would be worked on, would have a more pain-free postoperative period, and would even probably have a reduced length of stay in the hospital.
The event underscored the urgent need for investment in education, training and healthcare infrastructure to make regional anesthesia the standard of care in Uganda.
Today, we are commemorating this day to promote local regional anesthesia, which is much safer. And in Uganda, we are still not yet at the level. We would want to do more. The common one is the one I've told you.
Mary Namkose, Deogratius Habimana, UBC News.